Hi, Med P.
Hi, Dr. K.
How are you doing today?
I'm okay.
All right, my name is Dr. K. I'm going to be doing your exam today.
Thank you.
Anything specific that brings you in?
I'm not feeling that well.
Okay.
I think it started about 2 weeks ago. I've been experiencing some unusual numbness. It's on my right side of the head.
All right.
And also on my right side of the back.
Okay, so... Right.
I did have a rash as well, but that went away.
Okay.
I'm not sure if those were related.
Where was the rash?
The rash was kind of on the right side of my back.
Okay. All right, first, can you verify your date of birth?
June 2nd, 89.
Okay. All right, and do you have any known allergies that could have caused this?
No.
Okay. When's the last time you had an allergy check?
I don't remember.
Okay. Does the sensation, does it come and go? Is it pretty much constant?
It's pretty much constant.
Okay. On a scale of 1 to 10, how is it right now?
It's about a 5.
Okay. Great. Any changes to your diet?
Not really.
Okay. Any changes to any topical treatments that you use, such as shampoo or lotion, serum, that may be different, dish soap? No. All right. Are you taking any medications on a daily basis?
No.
Okay.
I did travel recently.
Okay.
Maybe about a month ago. I was in Mexico.
Okay. That's good to know. Okay, and you said the symptoms started 2 weeks ago.
Yeah, 2 to 3 weeks ago.
All right. So, do you have any medical history of hypertension, skin problems, eczema?
A few years ago, I was diagnosed with hypertension.
Okay.
But I was able to bring it under control, and I'm not having any more issues now.
That's very good. Are you taking any medication for that?
No, not at the moment.
Great. Do you have any thyroid issues?
Yes, I do. I was diagnosed with hypothyroidism.
Okay.
2 years ago. I was on medication, and for about a year. And after that, my blood levels were normal, so they took me off.
Okay, and it's been fine ever since?
Yes.
That's good to hear. All right. Any accidents in the last year, a traumatic impact, a car accident, falling down?
I mean, here and there, I'm a little bit clumsy all the time, but not that I can remember right now.
Nothing specifically traumatic. Okay. All right. Let me go ahead and check your vitals. All right, I'm going to start with your blood pressure. Can I go ahead and use this arm?
Yes.
Okay. All right. Do you mind holding this for me?
Sure.
Thank you. Okay, 109 over 78. That's perfectly normal. All right, I'm going to slide this off. Taking your temperature and oxygenation. So can I have your index finger? Thank you. Okay. All right, you're at 96.9. A little bit low. All right. Your heartbeat is 80 and your oxygenation is 99% at room air. Okay. And listen to your heart and your lungs. So I'm going to ask you if it's okay to open your gowns just so I can have access to the skin so I can hear your heartbeat properly. Thank you. All right. All right, heart rate sounds normal. I'm going to listen on the bell side for any murmurs. Okay, I'm going to listen to your lungs now. Go ahead and take a deep breath in for me. In and out. Good, and again. In and out. And one more. In and out. Okay. Your lungs sound clear and healthy. You can go ahead and button that up. All right. Okay, so your vitals are all normal. I'm going to go ahead and have you lay down in the bed so I can examine your face and neck more closely. Okay. All right. All right. I'm going to start by palpating your face, and I'm going to be feeling your lymph nodes for any swelling. Okay. Pre-irregular lymph nodes are non-palpable. Feeling your post-irregulars. Also non-palpable, so that's a good sign. Okay. I'm gonna feel your sinus cavities below the eye or any fluid buildup. Alright. Going to check your sinus cavities above the eyebrows. No swelling. Going to palpate the mastoid bone behind the ear. Okay. No abnormalities. Alright, I want you to, on the count of 3, try to open your eyes. I'm not going to let you do that. 1, 2, 3. Good. Okay. Go ahead and try to raise your eyebrows on the count of 3. I'm going to resist your push. 1, 2, 3. Good. Any trouble doing that? Okay.
No.
Now try to frown your eyebrows and lower them. 1, 2, 3. Good. Okay. Relax. All right. Now I want you to try to turn your head to the right. 3, 2, 1. Okay. Very good. And the other way. 3, 2, 1. Okay. All right. I'm going to have you gently open and close your jaw. I'm just going to feel for any clicking or popping. Okay. Good and close. Alright, all sounds are normal. Go ahead and do the same thing again. I'm just going to gently feel along the jawline. Open and close. Okay? Okay, very good. I'm going to palpate the neck as well. I'm just feeling your thyroid gland. Normal in size, no swelling. I'm going to go ahead and look at the hairline here. I'm not seeing any irritation. I'm going to be doing a more in-depth examination of the scalp here in a bit, but this is just a preliminary check. I don't see any redness along the hairline. Okay. Your hair follicles look healthy. So. Let me go ahead and give you something to smell. So keep your eyes closed. I'm going to hold it to your nose. Inhale. Let me know what this smells like. Eucalyptus. Very good. All right. I'm going to give you something to taste. Go ahead and open your mouth, and I'm going to lay this tasting paper on your tongue for 2 seconds. What do they taste like?
Sweet.
Very good. Okay. I'm going to do some measurements of your face just to look for symmetry, signs of swelling or edema. So just relax. Okay, that's 26. And if you could lift your head slightly, I'd like to measure the circumference of your head. Thank you. Go ahead and rest it. Okay. It's about 18 inches here. Oh, that's normal range. So you don't have to decide. Okay. It's about 8, so a little bit more on the left side, but that's still normal. It's voluptuous. Orange, okay. 6 inches from clavicle to ear. 6 inches symmetric. Okay. Okay, that's 15. 9 on the left. 9, okay. I'm going to be making a vibration with a tuning fork and resting it on different parts of your head. Will you let me know if you feel it and when the sensation stops? Okay.
I feel it.
Feel it. Stop. Okay.
I feel it.
Did you feel it equally on both sides of your head?
More on the right side.
More on the right side, okay. Okay. Just a few more.
I can feel it. Stopped.
Okay.
I can feel it. Stopped. I can feel it. Stopped. I can feel it. Stopped.
Okay.
I can feel it. Stopped.
Good. Okay. I just made a brushing sensation on both sides of your head. Did you feel that equally on both sides?
More on the left.
On the left, okay. So right side, some numbness there. Okay. What about now?
More on the left.
Okay. And now.
The same.
All right. What about now?
More on the left. More on the left.
Okay. Right. So I'm going to be brushing against your head once, twice, or 3 times. So let me know if you felt it once, twice, or 3 times, okay?
Okay. 1, 2, 1, 1,
Did you feel that on the right or the left side?
right,
Good.
2, 3, 3, 1, 3, 2.
Good. All right. Okay. Do you feel this is a sharp sensation or a dull sensation?
Dull,
Dull? Okay. What about this?
dull, dull,
All right. Keep saying sharp or dull.
dull, 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 sharp,
Okay.
sharp, dull, dull, sharp, dull, 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 sharp.
Okay. Definitely some inconsistencies there that I am concerned with. I want you to go ahead and open your eyes. And can you raise this spelling chart at arm's length in front of you? You could tilt it down a little bit more. Can you see that?
Yes.
Okay. Can you go ahead and read that third row for me, starting with O? On the fourth row, yeah.
OLCF
Okay, what about the one below it?
DHJBS
And the one beneath that, starting with the right side, so starting with that O.
OCDBE
Mm-hmm. What about the next row?
JHDFC
And the last row from left to right.
B O
Okay.
E B, and that looks like an H.
Okay. Great. What's this color here on your right side?
Green.
Okay. And on the left?
Red.
All right. And as you look at that last row of circles, starting from the 2 to the 9, do those circles seem to be getting larger or smaller?
Larger.
Okay, very good. I can go ahead and grab that from you. I'm going to go ahead and take a look inside of your eyes, so if you could just open for me. All right. Your pupils are round and reactive. I don't see any jaundice or excess veinage, no redness. You don't have dry eyes. I'm going to check the other side. I'm seeing something similar here. Do you wear contacts?
No.
Okay. At the end of this appointment, I'm going to give you a referral to an optometrist because you do seem to be suffering from nearsightedness. Just from my preliminary observation, you weren't able to read that last row of letters when a normal 20/20 vision person would be able to, but that's nothing that contacts, prescription, or glasses won't do. Okay, I'm going to go ahead and take a inspection of the scalp. I'll be looking at different parts of the hairline. You can go ahead and lift your head for me real quick. Very good, okay. All right. I want you to tell me if this feels like a sharp or a dull sensation. Dull. Okay. Dull. 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 Okay. Going to be bringing a couple different temperatures to your part. So this will feel like a warm sensation and this will feel cold. Do you feel the difference?
No.
No? Okay. Do you feel this as cold or warm?
Warm.
Okay. Cold or warm?
Warm.
Okay. Cold or warm?
Warm. 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 Warm.
I'm going to be applying 2 different pressure points to the hairline of the scalp. This will be 1. This will be 2. Let me know if you feel 1 or 2.
1, 2, 1, 1, 1,
Okay. Doing an inspection here. I do see some slight redness near the crown of the scalp, which could be caused from skin infection that is slight. It definitely has not spread to the front of the head. Go ahead and tell me again if you feel sharp or dull. 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 Okay. And does this feel like a warm or a cold sensation to you? Warm. Okay. What about this? Warm. 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 Okay. Or cold, or did you feel nothing at all? Warm. Okay. Warm. 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 Right. And there are these 1 or 2 pressure points here. So this will be 1. This will be 2. Just a second here. Alright. So let me know which one you feel. 1, 2. 1, 2. 1, 1, 1, 2, 2, 1, 1. Two. Going to be bringing a sensation from the base of your scalp to the very front of the hairline. Let me know if you feel it the whole way, or if you have any areas of numbness, let me know.
I didn't feel that.
You didn't feel it at all?
No.
I'm going to do it one more time. No sensations?
No.
Okay. And does this feel cold all the way up the hairline, or does it feel like nothing at all?
Like warm.
Okay, that felt warm. Okay. Tell me warm or cold, okay?
Warm. 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 Warm.
And I'm going to be doing a series of brushes. Let me know if you feel the brush once, twice, or 3 times. Okay, so say 1, 2, or 3.
1, 1, 2, 3, 1, 1, 2, 2, 1, 1, 2, 3.
And go ahead and say sharp or dull.
Dull. Dull. Dull.
Okay.
Dull. 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 Dull.
Okay, Med P, you're having some very significant sensory issues. You were not able to determine between sharp or dull, warm or cold, so there's definite intense numbness happening in the scalp. I'm going to go ahead and move on to the back and see if the problems have radiated down, and then we'll discuss the treatments and our next steps, okay? So I'm going to have you flip over. Okay, Mad P, with your permission, I'm going to unbutton the first 3 snaps of your gown and also your bra, just to give me access to the skin of your back. Okay. All right. So I'm going to start just by palpating your neck and spine, okay? Just feeling for proper alignment.
Having a little bit pain there.
A little bit of pain right here in the middle.
Yes.
Okay. Is it an itchiness or a throbbing?
More like a dull sensation.
Dull pain.
Dull pain.
Okay. I'm going to continue to palpate down the spine to your mid-back. Let me know if the feeling persists, okay? It's about the same.
No, it's just in that one spot.
Okay. All right. I don't feel any abnormal curvatures. And don't see any signs of scoliosis. So. Any pain here on either side of your spine?
No.
No. Okay. So it's just that midsection. Okay. All right. I'm gonna go ahead and, do you mind if I just move your hair up? Very good. Okay. I'm gonna palpate your neck. Mastoid bone. I see a slight elevation of your scapula on the right side. I'm going to make a note of that. Sorry. Okay. Otherwise, the lower back seems to be symmetric. No swelling here. Okay. It's 15 inches. 16. So your right scapula is having some swelling. Okay. I'm going to do some percussions. Let me know if you feel any pain. So you said this area right here, you were having some pain. I'm going to be percussing all around the back, so I want you to know if any pain pops up for you, okay?
Okay.
All right. Okay. You're going to feel a light scraping on your back and just assessing your back for signs of inflammation or edema. Okay? Okay. Alright, you're going to feel a vibration on your spine. Let me know when the sound stops, okay? So say now.
No. 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 No.
Okay. Do you feel this as a cold sensation or warm?
Warm.
Okay. What about this?
Warm.
Okay.
Warm.
Does this feel sharp or dull?
Sharp.
All right.
Dull.
Okay.
Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Dull. Dull.
Do you feel this on the left or the right side of your back?
Right. Right. Left. 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 Right. 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 Left. Right. Left.
Okay. So, I'm going to move on to assess your legs and feet. You don't have to move or do anything, just continue to relax. All right. I'm going to be palpating your feet and your legs, okay? I'm going to feel for any kind of lumps or bumps or edema. Okay, if you could raise your leg, I'm just going to be feeling your shins. Okay. Okay. Doing some measurements here. This is 25. This again. It's 29. It's 33. Okay. 32. 32. Okay, so no swelling here. I'm just gonna do some measurements. It's 45. It's 44.5. Okay. Okay. Going to go ahead and raise your foot. I'm going to assess your capillary refill. 2 seconds. So your circulation seems to be intact. Okay, let's do this foot. Okay, excellent. I'm going to assess your Babinski response. You should feel a neurological sensation as I bring this pressure from your heel to the very tops of your feet. Okay, good. Okay. Excellent. going to do a sharp and dull test on the back of your feet. So tell me if you feel sharp or dull.
Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. Sharp.
All right. So we've completed the exam. I'm going to have you sit up and we're going to discuss the next steps to take, okay?
Okay.
Okay, Matt, I did a lot of neurological tests on your back and on your legs, and you are having some very severe numbness in the scalp and back, okay? So we're going to have further tests be done. We're going to do an MRI. We're going to send you to our local hospital, and I'd like, if you can, to send you there this afternoon because this is a very pressing issue. We want to rule out any signs of a stroke or anything major going on, okay? So do you have a free time at 2 p.m.?
Yes.
Okay. We're going to send you to the radiology department. We're going to do x-rays, all kinds of things, and hopefully we'll get to the bottom of this, but it is something that has to be addressed right away. So,
Okay.
All right. Other than that, you're healthy. Thanks for allowing me to do this exam. Your vitals are all fine, and I'll look forward to seeing those results, and I wish you the best of luck there.
Thank you.
All right. Bye.